Well, my name's Jani. I'm 63. I'm currently working for Watson Clinic as a nurse anesthetist. Prior to that, I grew up in Calgary, Alberta, Canada, and did snow skiing and stuff like that, but I really enjoyed competitive water skiing. The sport itself is high impact. It's very aggressive, very hard on your body because you're using a lot of force. As an athlete, I just got arthritis, and it got pretty significant in my hips, and so I had a recommendation to get a hip replacement on the left side, and I had a physician do it. He did a great job. It worked out fine. Got back to skiing, but my right side was much more significantly arthritic, plus way more painful. And at this time, working in the OR as a nurse anesthetist, I got to firsthand observe Dr. Vo actually do procedures, and I knew that I wanted him to do my surgery so I could get back skiing as quickly as possible.
You know, realistically, this is a mechanical problem. The joint has worn out. It's kind of like the rubbery part of the tire is gone and you're driving on the rim. So no matter what medication you take or oil or lube, it's a rough ride. So basically we changed the tire. So we had to cut away the old surfaces and put new surfaces down that are nice and smooth, and put new cushions in so that the joint is restored. And then after a period of healing, they do very well.
I mean, I told him that my right hip was very painful, and he knew that I did competitive skiing and went to the gym and worked out, and he knew that I ski every Tuesday, Thursday, Saturday, and that was the main thing. Is his expectations were that I would get back to that level, and I did.
The hip joint here normally has a ball which is spherical that fits into the socket, and there's a cushion that separates the ball and the socket. That cushion is about a 1/4 inch in thickness, and that's the cartilage, the rubbery part on the tire that absorbs the shock. But that is gone in Dean. There's an x-ray here, the bones kissing each other. The cartilage had completely worn out and the bones wearing on each other. We come in, open the hip up, ream out the old socket that is no longer spherical because it's so worn out, and then we put a new socket in, and then we put a new liner within that socket. And on the lower side, the thigh side, we remove the ball here, as you can see, and then we put this stem in. This is a titanium stem, and then we put a new ball in. This hip could last more than 30 years, even with his activity level, so it doesn't wear out.
I think I started skiing within 12 weeks. I got on the water in 12 weeks.
A week or two, he gets off of the crutches and the canes, and he can walk normally, and he returned back to work, I think, within a month.
I was already back competitive skiing in December of that year, not even a year's time.
All kind of tricks and, hops and jumps, I don't even know the terms of the things that he does.
He is skillful, he's competent, he has done many of the cases. That is important, having experience and a lot of cases under his belt. He's extremely efficient, and his team's efficient, and he's a friendly guy. He's a smart doctor, he's a smart surgeon. I don't have any pain whatsoever. I'm back to where I was before the surgery. I'm back to where before when I had pain, and it worked out great.